Today we're going to do a kiddogram. This is when a patient swallows a coin or any kind of foreign object, and you need to take a look into the GI tract to see where it is at. So first we're going to start by setting up our technique. Come on to the back. Back here we have it set on about 80, so anywhere from 60 to 80 is going to be good for a kid. Obviously the smaller a baby, the lower you want to go, or larger the child up to like 18, and then you want to increase the kVp and your MAS. MAS is comprised of MA and your seconds, which gives you MAS. So 10 would be good for a kid, or lower. So once again, if it's going to be, a baby, you're going to lower this all the way down to possibly even like 2 to 5. And then for older child, go on up. Make sure this is set on table because we're using the table bucky. And just for reference, this is at 201/20th. All right. So now we're going to make sure our tube is aligned and the top arrow is at 40. And turn this on. Make sure we're lined up with our board. Our board is in here lengthwise. You can put the marker somewhere in here if you'd like, but it's easiest to just put it right on the table. So I'm going to put this right next to her here. Make sure it's not in the anatomy. Good. And to make sure that you got everything in here, first of all, I'm coming in. We don't need all that excess. And to make sure you have the whole GI tract, you want to get from about the nasal passages to the pubic symphysis, or just a little lower than the pubic symphysis, to make sure you have the whole GI tract. If you are unable to get it in all in one picture, I would start up at the nasal passages and to where about mid where it would be, and then take a second picture or even just a bladder spot. If you have any questions, let me know.